was shocked. I did not believe, I'd heard stories, but to kind of live through it was kind of shocking to me. Clearly driven more by price controls and regulations versus what's best for the patient and the doctor. There are doctors that just said, that they kind of had allocated him that he was old. Putting resources into him was kind of a waste of money, and I should really just, go along with everything. And a government-run monopoly does not give you the best care, and you're going to have to live with what you get. My name is Lorna Finman. I was born in Britain, familiar with the UK medical system. We moved to Canada when I was younger, grew up there, and then I came down to the United States, went to Stanford, got a doctorate in physics, then married my husband there and became American citizen. So I'm familiar with the UK, the Canadian, and the American healthcare systems. I was living in Canada before the Canadian healthcare system, or they call it the Medicare system up there, started in the early 70s, I think 1971. It was enacted. And everybody was actually at the time very supportive of it, thought it was great. This was like the best thing ever for everybody. Some money taken out of your paycheck every week as a tax. It wasn't a lot. You could go to visit the doctors whenever you want, and this was too good to be true. What started happening is Canada started having the economy went into a bad way. So initially they were giving each of the provinces, I think, 50% of the funding they needed to carry out the health care. And when the government started having budget issues, they started putting in price controls, caps on everything, and then demanded that none of the doctors charge any more of the billing fees. And this ended up creating kind of a brain drain in the country, where a lot of the best and the brightest doctors went to the US. And also for their budget cutbacks, they cut half in the education of the doctors and their schooling. They funded half of them. They cut it way back. Longer waiting times, critical doctor shortages, and I was aware of what was going on, but on the surface everything still seemed pretty, maybe it's still reasonably good. 4 years ago, my father had a stroke in Toronto, and I flew up there immediately. And he was about 80, 81 when it happened, and I was just continually shocked by kind of the attitude that he's over 80. You shouldn't have hope. He's just going to. He's not going to make it, and I kept saying, well, shouldn't we be running more tests? No one's, you've taken the IV out, he's gotten dehydrated, this, and then I tried to get a hold of his doctor, who kind of rushes through the hospital because he has a certain quota to fill, his, price to meet certain quotas, he's got to get volume, so he's rushing through, and I said, I started asking questions, and his, he had a very negative attitude, saying this is just the way it is. And I said, can you test him? Can you check? And then they concluded that, he's incoherent. He doesn't understand a thing we say. And I said, well, maybe if you put his hearing aids in, we might be able to have a more legitimate test. But anyway, they didn't want to repeat the test. And then I found him shaking, and then they told me he had Parkinson's. And I said, how can he have Parkinson's overnight? And I said, his shaking is due to dehydration. And I had to force them to kind of come and look and put the IV back in. And it was just one thing after another. Doctors had just said, that they kind of had allocated him that he was old. Putting resources into him was kind of a waste of money, and I should really just, go along with everything. And that is not my nature, to go along, and especially when it's about my dad. And I had to have a confrontation, and they recommended me I should just take him out of the hospital. And we were willing to do whatever. My husband and I were willing to mortgage our house to get him into a private option. And that's what we did. We got him over there, and he came out of it after a couple of months fine, recovered fully, and lived a healthy, the next 4 years he lived very healthily. We just passed away actually 2 weeks ago. And you know, when you have critical doctor shortages like that, they started recruiting from other countries to bring in doctors. The other countries were not happy with that kind of approach because they were losing their doctors. We can train some other people in a short-term program, a 9-month program, physician assistant, or we can use nurse practitioner. And everything is, you know, clearly driven more by, price controls and regulations versus patient, what's best for the patient and the doctor. We were all on the bandwagon when it started. We thought it was great. The federal government, started out saying there'll be flexibility for the provinces and opt-outs and choices. And over time, with budget, which inevitably happens, the budget gets tightened. You have government-regulated monopoly like you do in the UK and Cuba, and a government-run monopoly does not give you the best care, and you're going to have to live with what you get. If you want a public-run monopoly for your health care, I find that very disturbing and scary. If I have a serious medical problem, I'm not going to go to Canada for health care. It covers a lot of the routine maintenance things, but they have, everything in Canada is focused on reducing the cost and delivery of resources. You don't have a recourse if you've got doctors with bad attitudes or don't care or just sort of shoo you away and say, that's the way it is. And people there have, become to accept it and say that's the way it is. And in Canada, they'll accept it and say that's the way it is. And, I've had the personal experience. I've seen my relatives in Scotland wait 1.5 years for a bypass surgery. And in 1.5 years, anyone who knows anything about heart problems, you may not make it. Another close friend of mine in Canada, her job is to work with doctors that have a bad attitude. Why don't you fire them? And her response was that we cannot fire them. We have such a critical shortage. So we've got to keep everyone that we have. And I hope that we don't go there. Thank you.